Hi everybody, Dr. Sia here. Welcome to the What's the Diagnosis series. If you haven't checked out my intro video on this series yet, make sure you do that now. In this video here today, Ravi's come to therapy not for himself, but for his daughter. We don't really quite know what's going on for her yet, but maybe together with Ravi, we're going to figure it out. Now, you're going to get a chance at some point when we pause the video to develop your own hypotheses about what you think is going on for Ravi's daughter. Now, at the end of the video as well, I'm going to wrap it all up and we're going to have a discussion. So make sure you stay put and all the way through, and I'll see you at the end. Ravi, what are the problems you've been having?
Well, I mean, it's not about myself. It's first of all, I'm sorry about the glasses. I've just had LASIK done a few days ago, so I'm still a little bit sensitive to light.
Please.
It's about my daughter.
Okay.
She's 8 years old.
Yeah.
And I've never found anything wrong, anything to be concerned with out of the ordinary.
Okay.
Compared to any other child her age. Excuse me.
That's good.
But I've been getting a lot of complaints from her teacher.
Okay.
That she's really disruptive in class. In the sense that she doesn't focus on her work. She doesn't sit still. She doesn't. If they give her a task to do, a few minutes later they find her doing something else unrelated to what she's been told to do.
I understand.
And they sort of insisted that I have her assessed.
Uh-huh.
And they wanted her assessed by a particular GP.
Uh-huh.
So I said, okay, fine. I'll take her to your GP.
Yeah.
And
you say they? This is the school.
The school.
The teacher.
That's right. So they had her go to this particular GP.
What's your daughter's name?
Bella.
Bella.
Yeah. They had me take her to this particular GP, and the GP spent about 20 minutes with her.
Okay.
During which, I don't know, I mean, I assume it's some kind of a standardized test, but it seemed like a bunch of really, really basic questions and whatnot.
Sure.
And then they gave me a diagnosis of ADHD.
So the GP gave your daughter a diagnosis of
ADHD.
Sure.
And they recommend that I go to these parenting classes on how to deal with children with this condition, and they want to put her on some kind of a medication and all of that.
Uh-huh.
And before this I asked permission from the principal, and I sat in on a class.
And this is
in the school
when they started reporting to you that there are things going on for her.
Because I've never seen any of this behavior.
No.
At home.
No. What are the kind of behaviors that we're talking about?
All this, I mean, this kind of restlessness, inability to focus on what she's doing.
Yeah.
She's disruptive in class because other children are focusing on what she's doing rather than what they're supposed to be doing.
I understand.
She talks too much. Her mind doesn't focus on one subject. If the teacher's talking about something, she pays attention for a minute, and then she's thinking about something else.
Okay.
All this kind of thing.
So there are some inattention and concentration problems and some energy problems, according to the teacher.
Allegedly,
yeah.
Which I've never, I've spent 8 years with this child.
I understand, yeah.
I've never seen any of this at home.
No.
I mean, obviously sometimes she doesn't focus, but that's she's 8 years old. Sometimes she doesn't focus.
Yeah.
But for the most part, she's not disruptive.
No.
She's fine.
Yeah.
She plays perfectly well with her brother.
Yeah.
It's
nothing. What about other children, outside of home? Does she play well with them too?
Perfectly fine. Even in school, she plays perfectly. I haven't heard anything from other parents that my child is disrupting their child's focus or anything like that. So,
and what about at home with tasks that are not play, homework, things like that?
Yeah, I mean, sometimes she doesn't. Occasionally, she doesn't focus, but that's. I don't know any 8-year-olds that are laser focused on doing their homework or doing their chores or putting their toys away or anything like that.
Does she get the homework done?
She gets it done perfectly fine.
Okay.
Especially, I mean, if it's a subject she likes, she gets it done like that.
Yeah.
So if it's a subject she doesn't like, she takes a bit longer with it and stalls and finds excuses.
Yeah.
But I did that as a child.
Yeah. But you don't find yourself sort of constantly having to chase
her? No, nothing like that. And she's even if it's, if she knows that it's time to pick up her toys and put them away, she does that.
And when you
She's
say
a-
subjects that she doesn't like, I'm just wondering, how long have you lived here in Australia for? How long has she lived in Australia for?
just about like a year or so.
A year or so?
Yeah.
And before that, you lived in
Mauritius.
Mauritius,
Right.
okay. And what was her English training
Well,
like
not a
over
lot
there?
not a lot of English back there.
No.
She learns French.
Sure.
And we speak Khmer at home, which is
Yeah.
our native tongue.
Sure.
So she's fluent in those two languages.
Okay.
She's still sort of getting used to English a little bit.
Okay.
But I mean, it's not like she makes herself understood, and when you
Yeah.
tell her something in English,
Sure.
she can.
Okay.
Yeah, she.
I'm just working on an idea here.
Sure.
I'm trying to understand something. These subjects that she like,
Yeah.
are they sort of non-language based? Are they like mathematics and
Right, right. So she loves like science and math.
Yeah.
She loves doing.
Okay.
Things like history, she's not so interested in.
Okay.
So when it's like I said, science or math homework, she's all over it and gets it done.
Right.
History, she just sort of dawdles and takes her time. But it's not like she's not focused. It's
Okay.
just that she's disinterested
I understand.
in this. Yeah.
And and she speaks these other languages too.
Absolutely. Those are her go-to languages.
Yeah.
Because that's what she's been used to for most of her life.
Right.
And she's still sort of feeling her way
Right.
through English. The grammar and the syntax and
Yeah.
everything is completely.
Yeah.
It's not exactly a match for
No.
either of these languages that she's used to.
I understand.
And when you tell her something, she understands it, and she just takes a minute to respond because
Yeah.
she has to formulate.
And when you notice her being in situations where there's a lot of English and you're not there to translate for her or things like that, do you notice her getting a bit anxious and maybe riled up then too?
Well, yeah, I mean, she's a little uncomfortable while she's going through that whole process of.
Yeah.
I suspect what she does is form a sentence in one of the other languages and then translate
And then
to
translates
English.
over to English.
So I suspect that's what she's doing.
Okay.
But when she answers, it's a
Yeah.
coherent answer that's relevant to what she's been asked.
Yeah.
So it's not like you ask her about her homework and she's
Sure.
talking about swinging in the
Sure.
park.
So English is sort of her third language?
That's right. That's right.
Okay.
And we have a tutor come home to help her with English.
Yeah.
And I've had no complaints from the tutor.
You're
The
right.
tutor's really happy with how she's progressing.
Okay.
And I haven't any of these disruptive behavior that the school's talking about. I haven't noticed any of them at home.
No.
And this doctor
Have they
just-
offered her language support at
nothing at
school?
all. Nothing at all so far. And all they've done, like I said, I asked permission from the principal and I sat in
Yeah.
on a class
Yeah.
to see if she's doing anything different to what she does at home. And I didn't see anything.
And
that
what were they studying when you were there and watching? Were they doing English or were they doing math or science at the time?
Well, they were doing science.
Right. Okay.
But-
So I mean, there's almost like there's some ideas coming together for me here. Let me see what you think, because my thoughts here are. Ravi, that I don't think that Bella is experiencing. It might not be ADHD.
Thank you for saying that. That's I don't
Yeah,
I don't
mean,
know
it sounds
how.
like she's only struggling with English in school. The only time she gets these sudden ADHD symptoms
Mm-hmm.
is when it's English based. I'm quite concerned why no one's thought about the fact that this could be her just not being really
Adjusting to the
familiar with the
language.
English language. And if she sits there and she studies really well and she's really focused when it's mathematics or science or anything like that, and then you're saying at home as well and with children, it certainly doesn't sound to me like ADHD only happens in one situation, because ADHD, if it's a neurodevelopmental problem, it almost suggests that it would happen across contexts.
Right.
That you should see things like that at home happening. You should hear some reports with friends. You should hear reports from school, but it's not that it should only happen in one place. You imagine if you have something going on in your brain that's almost developmental and neurological, it shouldn't just be for one situation.
Right.
It should be for many situations. But it sounds like what you're talking about, this ADHD diagnosis only pops up when we're talking about English.
And only in school.
And only in school, and only English in school, English-based
Right.
subjects at school.
Right.
All right. Okay. So maybe what we can do is I can have a conversation with your GP, have a look at the assessment that was done. I'll have a conversation with the teacher as well, and I would love to meet Bella.
Sure,
If
absolutely.
possible, and then maybe you and I can figure out some things that we need to put in place to look at whether this diagnosis is true or not, and if not, and I suspect not, that then what we can do is to see what we can put in place to actually help her with her English and inform people who need to be informed that this is what's going on for her, to find her the appropriate support. How does that sound to you?
Sounds great.
Yeah?
Yeah,
Okay.
absolutely.
All right, well, let's do that. All right, so that was our session with Ravi. Now, I don't know what your ideas are about this, but my impression was strongly that this is probably not ADHD. I mean, what we saw together here was that Ravi's daughter, Bella, is actually quite focused. She's focused at home. She's focused apparently with friends. She's not getting any other complaints anywhere else but with school and but with English. I mean, how is it that so often children who are not even anywhere near an ADHD problem get an ADHD diagnosis so easily? And obviously this was what Ravi was upset about. And I don't know if you noticed it, but I felt some of that frustration in the session as well, where he's coming in saying, he just sat down with the GP for 20 minutes and they did some paper. I don't even understand. Is it a standardized test? Is it? I don't know. And all of a sudden, my daughter has an ADHD diagnosis. This is what really good psychodiagnosis can do. That's why we need some really good psychologists, social workers, psychotherapists, counselors out there to do solid assessment so that we can help children who are at risk of being misdiagnosed from not being misdiagnosed so that they can get the help they need. And in this case, as we saw with Bella, it was just with English and in one course. And not to attack anybody here. Teachers are doing the best job they can. GPs are doing the best job they can. But it's about us doing the best job we can. And it's about you doing the best job that you can to support teachers and GPs and nurses and whoever else is out there trying to do the best with their job. And what we can do is to do a thorough assessment. And part of doing a thorough assessment of ADHD is to make sure that you check for if the problem happens in one setting or in multiple settings, and some of the other surrounding factors, like is it just with a particular subject, or is it multiple subjects, is it just that they're not paying attention, is it some other language problems going on? And look at this with Bella, this seemingly genius kid who knows like 2 languages already and is struggling with her third. Seems like when she's at school, she just starts losing attention. I mean, that just seems normal to me. Again, we don't want to be sure. So what we want to do is to build a hypothesis and then continue investigating. So what I say to Ravi is, bring Bella in, let's have a look. This is what I suspect. I suspect that it might be a language thing going on here where we can just help her learn some English, but I don't want to bank on it yet. Let's keep investigating. And Ravi was super happy with that. I hope you really liked the video. I hope you're interested in these kind of topics. I hope you like and subscribe, and I'll see you next time.